Hi, this is our presentation on Medicaid and Medicare. My name is Anushka.
My name is Jazara.
My name is Surjana.
My name is Jade.
My name is Anna.
My name is Marlene.
So the benefits that Medicaid provides is it's important for those facing homelessness to still have access to secure and basic care services such as behavioral health services, which includes mental health and substance abuse services, case management to help clients take the right steps and monitoring care plans, personal care and assistance services, and home and community-based services. Medicaid also offers a wide range of healthcare services like primary care, emergency care, mental health services, substance abuse treatment, and prescription drugs. There's also access to preventative care that provides patients with screenings, vaccinations, and wellness exams. No matter your position, people deserve to have the resources that allow them to take control of their health. Preventative care allows for the detection of health issues early on and prevents more serious health complications. Many individuals experiencing homelessness struggle with mental and substance abuse issues. And fortunately, Medicaid provides coverage for those behavioral health services. This includes services like counseling, therapy, and substance abuse treatment programs.
Okay, so some more benefits for Medicaid is that some Medicaid programs offer supportive housing services like assistance with finding stable housing and case management, which can be a variety of personal care in terms of medical, social, or educational services. Also, particularly for those facing homelessness and likely multiple barriers to accessing care, Medicaid often provides care coordination and ways to help navigate the healthcare system and access programs. In states that have expanded Medicaid eligibility under the Affordable Care Act, more low-income individuals, including some that face homelessness, may qualify for Medicaid coverage. Some states aim to coordinate care for people with complex health needs, which their goal is to improve quality care and reduce costs. Last but not least, Medicaid also provides low-cost health for eligible children and pregnant women, and this is especially valuable for families experiencing homelessness.
So despite of all these benefits, a few limitations need to be addressed. To be eligible for Medicaid, applicants must have proof of income, proof of citizenship status, and proof of state residence. These items may be difficult for some communities to provide, especially for the unhoused. After getting approved for Medicaid, there may be further restrictions. Not all healthcare providers accept Medicaid, so applicants should also contact local providers to learn more about their availability.
Now moving on to Medicare. Some of the general requirements in order to apply to Medicare include either being 65 years or older, or if you have a disability, end-stage renal disease, or ALS, otherwise known as Lou Gehrig's, you might also be eligible to apply for Medicare. Within Medicare, there's 4 parts, parts A, B, C, and D, and they can be used as 2 different plans with A, B, and D, or you can just have Plan C, which is Medicare Advantage. Plan A is the most basic level, which is generally premium-free depending on whether you've worked for about 10 years and paid your Social Security taxes, or if you got Medicare before the age of 65, or if you fall into the categories of the disability or disease in order to apply to Medicare. Part B is what can be considered medical insurance. So that covers any kind of outpatient services such as doctor visits, lab tests, and outpatient surgeries. And that part usually has a premium, which means that you pay a monthly fee regardless of whether you use the plan or not. Part D covers any sort of prescription drugs. And Part C, which is the Medicare Advantage plans, can generally combine all of the benefits that parts A, B, and D give into one single plan.
Now moving on to the cost of Medicare and the different parts involved. It's important to know that all Medicare plans, including Part A, B, C, D, and Medigap, come with a monthly fee. Now let's break down the specific costs for each part. Part A typically costs either $278 or $505 a month. This depends on how long you or your spouse worked and paid Medicare taxes. Part B has a standard premium of $174.40 per month, though this amount can increase if your income is higher. for Part C, also known as Medicare Advantage, has an important limit to note, and that is the maximum you'll pay out of pocket in a year is capped at $8,850. Understanding these costs is important so you can explore your options and get the healthcare coverage you need.
As of now, Medicare is not accessible to the needs of people who are currently experiencing homelessness. However, places like Los Angeles are trying to come up with ideas similar to Medicare Advantage plans that can focus on a more special needs program, which can help the people who are currently facing homelessness. In these kinds of plans, they would deal with addiction treatment, chronic disease management, transportation to care, and other benefits that might provide for people who are experiencing homelessness.
So I'll be explaining the Medicare Advantage plans. They're also known as Part C or MA plans, and these plans are offered by private companies that are approved by Medicare. And they simply provide an alternative way to get your Part A, which covers the hospital insurance, or Part B, which is the medical insurance. Basically, they work since the government pays a monthly amount to the private company that's offering the plan. But the plans are still required to follow Medicare rules. And one important difference is that the out-of-pocket costs can vary across these plans, which makes them different from the actual standard Medicare plans. And they cover all the benefits from both Part A and Part B. Plus, most of these plans also include drug coverage, which isn't always part of the original Medicare. And they can offer extra benefits such as vision, dental, hearing services, along with fitness programs and wellness services, which aren't typically included. And these costs will vary depending on the plan that you choose, and you can expect to pay premiums, deductible co-payments, and coinsurance. Your out-of-pocket costs also depend on factors like how often you use the healthcare services, which doctors you choose, and what extra benefits you might need. So the Medicare Advantage plans are more flexible and have more benefits, but again, it's important to evaluate the cost and coverage options to find the best plan that works for everyone's needs.
Thank you for listening to our presentation.